around the ecosystem is a lot of AI, agentic AI, AI slop, dot AI on thousands of different companies.
Sure.
There's thousands of people that are pitching you on the daily. How do you distinguish what is real, what's fake, and what is future to actually bring into the organization to service your members? What's your name and who are you with?
Kevin Kappel. I'm the Vice President of Corporate Development at Scan Health Plan.
Okay, and what is Scan Health Plan? How many members? Where are you guys located?
Scan is a nonprofit Medicare Advantage plan based in Long Beach, California. We serve about 300,000 members, a little bit more, across California, Arizona, Nevada, New Mexico, and Texas. And we're launching in Washington State next year.
Okay, tell me a little bit more about what you do and why you do it.
Sure. So, Scan has a really interesting story, founded in 1977 by a group of community activists that we lovingly refer to as the 12 Angry Seniors. The whole purpose of Scan from the outset was to help seniors age independently in their home. So that they didn't have to go to institutional settings.
I think you touched on something that's really foundational to the success of the aging communities. How do we help them age gracefully in the home with technologies and support that? It's very unique from a payer perspective of really setting a foundation of success in the home. Is there certain technologies in the home that you think Scan could leverage now or potentially in the future that would really impact this patient population, reduce the cost of care, improve quality, and really help your entire membership thrive?
There is a whole host of technologies that I think hold a lot of promise for the future. Um, Everything from floors that have padding so that you don't break your bones when you fall, to smart appliances and flooring as well, windows, everything that can alert somebody if they left the windows open and it's freezing cold at night, so they don't kind of catch pneumonia. So there's a lot of different technologies. I think right now, we're really just starting to scratch the surface of that. We are not doing enough. That's not to say that we don't want to do more. That's the economics, who pays, and the cost of the technologies themselves are still just too high, with not enough of a evidence base that to justify the investment.
Well, I think that's something that's significant. First off, is recognizing there's a problem.
Yeah.
Having a impact-driven purpose and knowing who you're serving is also, I think, a key differentiator from a payer perspective. Now, once you start thinking that you know that you're not doing enough, what if you had something that was right in front of you now or in the future of what could transform or impact these patient populations? Is that something that you think the organization's ready to lean into or just needs a little bit more time?
Yeah, we are putting a lot of focus right now onto the member experience, right? And trying to think about how we can connect some dots that I think have been left out of healthcare discussion more broadly for far too long. Everything from people being lonely and having them connected to other people, making sure that the scripts that the doctor writes and the follow-up orders, that all of that DME or other equipment that needs to be delivered in the home is delivered in the home, that people know how to use it and to set it up. That's, I think, the trick is like, how do you standardize an offering that can be applicable and help all 300,000 of our members, regardless of whether they live in Los Angeles or the Inland Empire or Las Vegas or Texas. Some people in more urban areas, have mobility challenges above all else, right? People in more rural areas may have broadband and connectivity challenges.
I think that what you have spoken about is being thoughtful and mindful about your member population and being very strategic about what solutions or what merging technologies you deploy based upon the people you serve. And I think that's a very good perspective to bring in. Um, what we're hearing around the ecosystem is a lot of AI,
Mhm.
agentic AI, AI slop,
Mhm.
dot AI on thousands of different companies.
Sure.
There's thousands of people that are pitching you on the daily. How do you distinguish what is real, what's fake, and what is future to actually bring into the organization to service your members?
Yeah. We have an amazing head of emerging technologies, Corinne Strom, who helps us sort through the tech and what her background and expertise kind of is the initial gateway that these vendors have to pass through. We have made a number of investments in AI powered technologies. Cresta is one, a Bridge is another. Those are companies that we have not only brought into Scan as a vendor and to enhance the overall member experience, but we've also put money in them and we believe in them. Um, but the sky's the limit. There's a company that we have been talking to that would pretty much take all of the follow up, scheduling and kind of post that visit with the primary care provider kind of out of the realm of responsibility for the the member and then their family. That is pretty compelling, right? So that you don't while you are in the doctor's office, this technology can go ahead and be scheduling your specialty appointment, be following up with the pharmacy to make sure the script gets there. And so to have that type of frictionless um, experience, for members, I think that's probably the next, kind of wave of this.
When you start thinking about investments, is there specific criteria you're looking for, specific check sizes, adoption through the health plan? What's the criteria look like for folks that you're looking to bring into the fold?
We want to support the companies that we believe are making a real difference in the member experience. We don't have one check size. Most of we've made 10 investments. They have ranged, I think, from $250,000 to, a million. We are not going to be a majority investor. We want to be a presence on the cap table and we want to, kind of tell their story as part of the Scan story. So
Now, the most important, complicated question that you probably got all day long: who's your favorite band? What's your favorite song?
man, so I grew up with Tom Petty and the Heartbreakers, so I've got a little bit of a soft spot. Learning to Fly has to be the best song, yeah, I think that's what I'm gonna go with.
Okay, so if you could make your members fly
Yeah.
or help them learn to fly, what would be the one most important thing in the home to level the playing field for the entire payer population that can bring or raise up all boats? If you can, one fell switch, done.
Personally, and this might be a little bit of a cop out, but I think that with caregivers nowadays, that there's so much opportunity for us to have an AI powered caregiver. They're not going to be able to help mom get out of bed, to help mom get dressed, but they can take everything else off of mom's plate, and that's material, right? And freeing up time for the daughter or the son or whoever the caregiver is to actually spend quality time, with our parents and seniors as they age. Scan is an acronym. It stands for Senior Care Action Network. You could easily mistake it for a radiology company, some type of diagnostics, but that action word really means a lot to us, right? And so I think you're going to be seeing more action from Scan moving forward into the future. So,
Okay. So the future care, action, scan, there's things happening and they're happening quick. Kevin's the man. So if you want to join a plan that is really cutting edge and that's heading to the future, scan is where it's at. Thank you so much, Kevin.
thank you.